daily update. First, I want to make an announcement. Last month, our administration unveiled our Keep Maine Healthy plan, which is a multi-layered plan to protect the health of Maine people and our employees and visitors, while still welcoming people to visit Maine, come here and have a vacation, and support Maine small businesses while you're here, especially in the upcoming summer months. Well, we're here, summer months. The plan we announced offers an alternative to the state's 14-day quarantine, which up until then was the mandate. Under the plan, visitors to Maine either must certify that they have received a negative COVID-19 test no later than 72 hours before coming here, or that they will quarantine in Maine for 14 days, or that they've already completed their quarantine in Maine. We're requiring certification that a visitor has completed or will complete a quarantine or has recently tested negative for COVID-19, protects public health, and establishes Maine as a safe place to visit. And it allows tourists to come to Maine and support our small businesses. It's an approach that more states are now following. They're following our lead. Places like Rhode Island and Hawaii, they now both require negative tests in order to forego the mandatory quarantine for some travelers. So when we made this announcement, we also exempted visitors from New Hampshire and Vermont. Why? Because when adjusted for population, the prevalence of active cases of COVID-19 in those states is still similar to Maine's metrics. That remains the case today. When we unveiled the Keep Maine Healthy plan, we said that we would continue to monitor public health data in other states, particularly in the Northeast, and we would evaluate whether we could offer additional exemptions to this quarantine/test requirement. Today, based on a careful review of public health data, we are creating a couple of additional exemptions to Maine's quarantine/test requirement. In reviewing the recent metrics of Connecticut, New Jersey, and New York, we've concluded that these states demonstrate low positivity rates and an encouraging downward trend in the prevalence of the virus. As a result, we're announcing that as of this Friday, July 3rd, we are exempting those states from Maine's quarantine or testing mandate. That's Connecticut, New Jersey, and New York. That means residents of those states, Connecticut, New Jersey, and New York, as well as Maine people who visit those states, may travel to and from Maine starting this Friday without quarantining for 14 days or obtaining a negative test. We continue to monitor public health data in other states as well, and we're particularly focused on northeastern states within driving distance of Maine, where most of Maine's visitors in the summer come from. So if you're coming to Maine from any place other than New Hampshire, Vermont, Connecticut, New Jersey, or New York, you still must quarantine for 14 days upon arrival in Maine or obtain a negative test taken no more than 72 hours before your arrival. For everyone else coming to Maine, for everyone coming to Maine, whether or not your state is exempt from this testing quarantine requirement, we strongly urge everyone to know before you go. Get tested before you come here. What's the harm? Do it for your own peace of mind, for the peace of mind of families and people you may be visiting here in Maine, and for the Maine public. You could be sick and not know it. Something like 10% of people hospitalized with COVID-19 across the country had no symptoms, 10%. And while you may believe that you're at a lower risk than other people, lower risk of serious complications, you could be spreading the virus, whether or not you're at risk. You could be spreading it to a child who's battling cancer, has health complications, to a healthcare worker on the front lines of the pandemic, to a grocery clerk or cashier or a gas station attendant who could be spreading the virus then to countless other people, risking their health and risking their very lives. You can find a testing location near you wherever you are by visiting get-tested-covid19.org. Get-tested-covid19.org. When we in Maine continue to stand up more testing capacity across the state, And if you're coming from somewhere else, if you're from away and you can't find a place in your state to get tested, as a last resort, you can get tested in Maine, but you'll have to quarantine while you wait for your results. So again, please, wherever you come from, where you leave and come back from, know before you go. With more people coming to Maine's coastal towns and cities, the use of face coverings will become more important as well. So in the coming days, I will be issuing an executive order along the lines I've just described, but it will also require Maine's large retail stores and lodging establishments and restaurants and outdoor bars and tasting rooms in the coastal counties, Hancock, Waldo, Knox, Lincoln, Saginaw, Cumberland, and York, as well as more populated cities in other counties, the Bangor and Brewer, Lewiston, and Auburn. We're going to be requiring those entities, those businesses, to enforce the state's face covering requirement. What many people have suggested is simply a signage that will tell customers, no shoes, no shirt, no mask, no service. It's as simple as that. And it means that Maine and Maine business owners and their employees mean business when it comes to public health. It's a simple measure. I don't think we're asking too much. And we're focusing on those areas that expect an influx of people in the next few months, where it's so important, more important than ever, that everyone wear a mask. In the last week, states across the country, like North Carolina, Nevada, Washington, and Oregon, have all implemented similar strict measures related to face coverings, given the growing evidence that masks do significantly reduce the transmission of the virus. As we've done from the beginning of this pandemic, we will continue to monitor epidemiological data, case trends, hospitalization rates, as well as healthcare readiness and capacity. Those things will inform all of our decisions on lifting restrictions, reinforcing restrictions, and stimulating our economy. As of today, adjusted for population, Maine ranks 7th lowest in the nation in terms of positive cases, 7th lowest in the nation, 9th lowest in the nation in terms of deaths, 6th lowest in terms of patients ever hospitalized out of the 36 states reporting, and 4th highest in the percentage of people who've recovered out of the 42 states reporting, 4th highest in recoveries. If a review of the data, though, finds evidence of an increase in COVID-19 in this state, or finds a threat to our healthcare system, we will have to move quickly to protect Maine people. But the most effective way to make sure that we don't have to reestablish any restrictions and that we can keep our economy going is by taking care of ourselves and each other. So I'm asking all Maine people and visitors who love our state, please remember to wash your hands frequently, maintain 6 feet of distance between yourself and others, no matter where you are. And if you live here, stay home when you can, especially if you're older or have an underlying health condition. Wear a face covering when you are out in public if it's going to be hard to maintain 6 feet distance between you and other people. If we protect ourselves, if we protect one another this way, and our visitors cooperate in that as well, we can continue to reopen our economy in a safe way. And we can limit the spread of this dangerous virus as we welcome the tourist season here in Maine. It's up to every one of us. Before we take questions, I will now turn things back over to Dr. Shah for his daily update. Thank you.
Great. Thank you very much, Governor Mills, and good afternoon, ladies and gentlemen. I'd like to provide an update on where things stand with respect to COVID-19 from an epidemiological and public health perspective. As of this morning, there are currently 3,294 cases of COVID-19 statewide, representing an increase of 41 cases since yesterday. Of those cases, 2,671 have recovered, an increase of 25 recoveries from yesterday, and 105 individuals have passed away with COVID-19, the same number as it was from yesterday. Breaking down our confirmed cases even further, of the 3,294, 2,922 are laboratory confirmed, and 372 are probable cases. Right now in Maine, 29 individuals are currently in the hospital with COVID-19. 8 of them are in the ICU, and 3 of them are on ventilators. I'd like to provide an update on some of the outbreaks that Maine CDC has been working on. The first is a new outbreak investigation that we just opened. This is an outbreak among employees of the Landry French construction site at the Abbott manufacturing site. There are right now 6 individual workers at that facility who have tested positive for COVID-19. We've just recently opened our outbreak investigation, and so more facts will be forthcoming in the next few days. But based on what we know right now, individuals have been required to undergo a temperature check, wash their hands, and where possible, wear a face mask at the site. But we are working with the facility and the site itself to make sure that any affected and exposed individual is able to get tested and able to have their contacts provided so we can check in on them. I'd also like to provide an update on our ongoing investigation into an outbreak at Bath Ironworks. As of just now, we just wrapped up a call with them about 45 minutes ago, and there remain 3 individuals associated with Bath Ironworks who have tested positive, 3 employees there. There have also been additional close contacts of those employees at the work site who have now been identified, bringing the total number of close contacts of workers at Bath Ironworks to 58. We're working with both Bath Ironworks as well as with the union to ensure that all 58 individuals can get tested as soon as possible, and much of that testing has already been undertaken. The remainder are underway right now. We also continue to plan to speak with both Bath Ironworks as well as with the union on an ongoing basis, again, to make sure that the health and safety of employees remains as our top priority. Finally, a quick update on the Sedgewood facility. That facility is retesting all of their staff members today, and then tomorrow, again, retesting all of their residents. We will have results of both the resident as well as the staff member testing over the next few days. But as of right now, the total number of cases associated with Sedgewood remains at 33. A quick note on some of the vital medical assets that we track. There remain 398 total ICU beds, 132 of which are available. There remain 317 ventilators, 250 of which are available, and there remain available 441 alternative ventilators. And finally, a note about our positivity rates. As I do, I'd like to provide the positivity rate on a daily basis, a weekly basis, and a cumulative basis. So for the test conducted yesterday in Maine, for the PCR test that we focus on, there were 2,268 PCR tests conducted yesterday in the state of Maine. Of those, 34 were positive, bringing the one-day point positivity rate for yesterday to 1.5%. On a 7-day weighted average basis, that brings our 7-day percent positivity rate to about 2%. And on a cumulative basis, for the 96,610 PCR tests that have been done, for which reports have been electronically reported to Maine CDC, the cumulative positivity rate is now down to 3.85% for all the tests done for COVID-19. With that, I'd like to turn now to our colleagues in the media. Governor Mills, Commissioner Lambrew, and Commissioner Johnson and I are happy to take questions. Today's first question from our colleagues in the media goes to Jessica Piper from the BDN.
Thank you, Dr. Shah. 2 questions. The first one perhaps for you or perhaps for Governor Mills. On this face covering requirement, is it kind of a recognition that the requirement hasn't been followed so far? And how's the state going to enforce requiring retail establishments to enforce this new requirement?
What we envision is this will become part of the certification, the checklist that every business agrees to when they reopen or open, and part of the protocol. So it's not a major change, but it just reinforces the requirement that all staff in public-facing businesses wear a mask, and that customers as well wear a mask. And we're focusing really on the anticipated influx of people greater numbers of people in the coastal counties and in the cities of Brewer, Bangor, Lewiston, and Auburn in the next couple months. And that's where we're focusing the importance of wearing a mask, whether you go into a large retail store, restaurant, before you sit down to eat, that kind of thing.
Great. Thanks. Oh, go ahead, Jessica.
Thank you. The other question I had for you, Dr. Shah, was I know you just touched on the positivity rate. This past week was kind of the first we've seen in a while where there was an increase in raw case count numbers. And I was just wondering if you could address that. What do you make of it? Is it just more testing, or should we be concerned?
Sure, Jessica. The answer is that it is partly because of more testing, but not entirely. The reason I say that is that it is true that the number of daily PCR tests across the state have gone up. About a week ago, they were in the low 1,000s, and now we are regularly seeing days where the number of tests conducted is well over 2,000. So it is partly a function of additional testing, but not entirely. The reason I say that is that the positivity rate has crept ever so slightly upwards as well, telling us that in addition to more testing, there's also the possibility of additional spread within the community. Around that same time, what we've also seen is a decrease in the average age of individuals who have tested positive. This is all to be expected, as we've talked about for weeks and months now. As there is more resumption of economic and social activity, individuals go back toward the normal lives they had. It's likely, if not what we're seeing now, probable that there will be additional cases. Some of those cases now are amongst younger individuals as well. I think this underscores yet another reason why the governor's decision to require face coverings in these large public areas is so important. Face coverings, based on the science we have right now, are one of the surest ways people as well as employees and stores safe, and equally for younger folks to be wearing them because we've seen an increase of cases amongst younger individuals. I'm going to turn next to Dustin at New England Cable News.
This question is for the governor or Dr. Shah or whomever's the person to answer it. Why not include Massachusetts and Rhode Island in the states that are now allowed to come here without quarantine?
Sure.
I can start by saying we looked at the metrics. We looked at their positivity rates, Rhode Island and Massachusetts. We looked at their overall cases per million population. And on those objective criteria, basically Connecticut, New Jersey, and New York fit the bill. Rhode Island and Massachusetts, unfortunately, still aren't in the category of as safe as Maine. Let's put it that way. Maybe Commissioner Johnson, do you want to weigh in, or Commissioner Lambrew? Or Dr. Shah?
I'll provide just a few numerical pieces in addition to that, Dustin. As the governor said, the premise of our approach is to look for states where the residents are as safe as those in Maine. The epidemiological reason for that is that if the average resident in one of those states is as safe as a resident in Maine, then by coming to Maine, they don't bring an increased risk of having COVID-19 with them. So that's the overarching premise that we're using. Based on where things stand right now, the positivity rate in Massachusetts is still a good bit higher than that in Maine. Just last week alone, their weekly positivity rate was 2.5% still. In addition, they're still having more weekly cases per million as well. The same applies for Rhode Island. Their positivity rate is a hair above 2%, but their weekly cases per million are close to 300, whereas that in Maine is closer to 200 right now. Now, both states are in rapid flux, and so we're continuing to look at the data, but based on where they are right now, they do pose an added risk that's different from the risk that would be posed by someone from, say, Connecticut.
Now, would you be worried then that they would, some of these other visitors from the NYC tri-state, though, would stop in Massachusetts? Because logically, they would be traveling through that area that you've blocked people from here by car.
That's a possibility. Based on what we understand, it's generally a short trip. There's a likelihood, there's a possibility that folks may stop, but the incidental contact that they may have is probably much less than they might have otherwise. So it's a possibility, but I don't know that it poses a large risk from a public health standpoint. I don't know about you and your family, but when we're headed somewhere on vacation, we want to get there as quickly as possible and not linger too much along the way.
And lastly, I mean, if somebody wants to, and for whatever reason they don't get the test in their home state, let's say somebody from Massachusetts or Rhode Island, and I was at the Forest Avenue drive-through spot today, is your recommendation for them to go there and then stay put for 72 hours still? Like, is that the guidance for those folks?
Commissioner Lambrew, yeah, the answer is yes.
Yes. Although, yes, with quarantine until you get the negative test result, because 72 hours is our guide for before. And we put that 72 hours in because if you got a test a week or two ago, it's meaningless. So it really is, if you're going to test at home, we want to make sure you tested within a very short period of time before arriving in Maine.
But if you happen to get your test result back before that 72 hours, for example, some sites in Maine are returning results within 24 hours. Once you've got that negative test, then you're good to go.
You generally want to call in advance, make an appointment for most of these places.
Yes. Yes, indeed. We're going to turn next to Nora Flaherty from Maine Public. Nora? All right, we'll come back to Nora in just a moment while we turn to Megan from WMTW.
Thanks for taking my question. Quickly, it's actually two questions as they relate to outbreaks. One, in the Sedgewood facility, I know you said all are being retested, residents and staff. I don't know about how far you've gotten in epidemiologists have gotten in terms of tracing, contact tracing, but are we looking at a situation where people who work, in different facilities from facility to facility are passing this along?
So we have seen that phenomenon occur, Megan. I don't know whether that's the case with respect to Sedgewood. Right now, as you noted, our investigation and our investigators are trying to determine whether it was a specific employee who may have just brought it in from the community, whether it may have been an employee who brought it in because that he or she works in multiple facilities, or in some instances, it could have even been a patient who was transferred to the facility from, say, a hospital setting. In this particular situation, we have not identified the entrance of the virus into the facility. That's one of the top goals right now, in addition to working with Sedgewood to conduct these regular rounds of testing.
My other question is also sort of related to contact tracing. So more anecdotally, but you just mentioned the new outbreak at Landry French facility. So looking at kind of my notes in the past, we have Landry French, Eldridge Lumber, and Chinbro have all had outbreaks at some point, if not currently. My question is there something specifically about construction sites or people working together in these types of jobs where transmission becomes more likely? It seems like it's sort of a trend without being scientific, but just kind of looking at what we've seen so far.
Sure thing, Megan. What I would emphasize there is that in workplace outbreaks, one of the keys, and we've talked about this at these meetings, one of the keys of our investigation in a workplace outbreak is to determine whether the work site was the place of transmission or the place where people who otherwise congregate outside of the work site happen to just be. So what we know about a lot of construction sites in the modern era is that they involve subcontractors from multiple different states, as we saw with the Chinbro situation. As a result of that, those workers from multiple states, although they may be at the work site during the day, often may be sharing a hotel room or congregating outside of work hours together. So disaggregating whether the site of transmission was the work site, or perhaps where they're living, or perhaps where they're getting together after work, that's one of the essences of any workplace investigation. We never really determined, it's very difficult to determine where that transmission is occurring. There's nothing specifically unique about a construction site per se, but we are trying to determine in this situation where that transmission may have occurred. It does underscore the fact, though, that transmission of COVID-19 even among younger, healthy construction workers, can occur. Underscores why all of us should be wearing masks, face coverings, and other worksite protections where applicable. I'm going to turn back to Nora Flaherty for just a moment.
Hi, can you hear me now?
We sure can, Nora. Go ahead.
Oh, great. Okay. I have two questions about testing. Yeah, okay. I have two questions about testing, about people going to healthcare providers asking for testing and being told they weren't eligible because they were asymptomatic. And also, and you sort of started to talk about this, of people not getting test results back within 3 days. What is the reason for this, and what is the state doing to fix it?
I want to make sure, I think your first question, Nora, you blanked out for just a bit, but your first question, to make sure we heard it, was about individuals going to see their own healthcare provider and being told by their own healthcare provider that they don't meet their healthcare provider's criteria for testing. Is that right?
Yes.
Okay. And so I think the question sort of suggests the answer. Fundamentally, the decision of whether any particular healthcare provider would want to test any one of their patients is really that fundamental decision rests with the healthcare provider. Our standing order is designed to fill in situations where an individual may not have a healthcare provider and yet still want to go to a testing site, such as at a pharmacy, and get tested. But if someone's healthcare provider decides that, clinically speaking, a test is not warranted, our standing order doesn't really overcome that clinical decision. To put it differently, we don't stand between a doctor and any one of their patients. Commissioner Lambrew, is there anything that I missed?
I will add, though, that we do add a few categories in the standing order, including people with an elevated risk of exposure to COVID-19. That does include people coming from states with high prevalence, people who work at places where there's a lot of visitors from other states that may be at elevated risk, people of color in certain communities in Maine, they are at elevated risk. And we don't necessarily think that they need to go consult their own doctor. We think that they can go ahead, use the standing order, and get a test.
That's exactly right. We designed this as a way to bypass needing to find a primary care doctor if you don't have one, wait for an appointment with a primary care doctor, which can sometimes be a challenge. We designed this so that folks can go straight to a testing site and get tested, especially with keeping in mind those certain high-risk groups that Commissioner Lambrew mentioned. I'll add anyone participating in a large outdoor gathering as well. Nora, you also asked about the turnaround time for certain tests. There are larger commercial laboratories that are scattered across the country, which certain providers may use, where the turnaround time for getting test results back can be on the order of a few days. The Maine CDC laboratory in Augusta is typically able to return results to folks within about 24 hours or so. We're not running a backlog right now, but there can still be some changes based on what time the sample was received. But certain providers may opt to use larger multi-state commercial laboratories. Those samples may have to be sent as far as North Carolina, even further, for analysis. And that transport and travel time can add some time onto the test result process.
Am I incorrect that everyone is now supposed to be able to get tested in Maine if they?
I'll clarify that our order talks about three
available.
Yeah, I'm sorry, 3 categories of people. Not anybody. The word anybody is not in our standing order. Is 3 groups. Number 1, the traditional people with symptoms or a close exposure to somebody with COVID-19. 2, the group that we just mentioned, a group with elevated risk of exposure. And 3rd, as the state of Maine gets into what's called sentinel testing different population groups to see if there's underlying rates of COVID-19, that would also be covered under the standing order. But we do discourage people who are just curious, for example, from going and getting tested, because that test won't tell you much if you do not fit in one of those categories.
Zara, we're going to
I'm sorry. So testing is not being made universally available.
It is made available to those three categories: symptomatic or exposed, elevated exposure, or in one of the groups that the state of Maine will determine is eligible for sentinel testing.
We're going to turn next to Bob Evans at News Center.
Thank you. Yesterday, during a University of Maine Systems announcement, Dr. Liu with Jackson Lab said beginning this month, they're expecting to be able to do 20,000 tests per day. Is the Maine CDC or DHHS thinking about using some of that capacity to help test more tourists? And if not, why?
I'll begin, and Dr. Shah, you jump in. Well, we are encouraged by the expansion of lab capacity at the Jackson Lab, as well as our state lab. We partner with other labs in the state like Nordics. We are all in on how do we expand Maine-based testing for COVID-19. We feel confident that as we expand our own state capacity, we will be able to ramp up. We expect to be able to quadruple our own capacity by mid-July. But we view this all as complementary. We're glad that Jackson Lab has developed these kind of partnerships. We welcome different types of partnerships, and we are hopeful that we get to a point very soon where lab capacity is just not a barrier to people getting COVID-19 tests in the state of Maine.
Completely concur. There's plenty of space at the lab testing table, and the more laboratories that are offering and conducting tests in the state of Maine, in addition to the Maine CDC laboratory, the better off everyone in Maine will be.
Understood. One more question, Dr. Shah. One of our own staff members says their doctor told them that COVID tests have 20% false positives, suggesting testing someone with no symptoms might not be worthwhile. Is that correct?
So every test has some degree of false positives and false negatives. That's just a function of testing. I don't think the 20% figure is quite right. What we know about the PCR test that is used for COVID-19 in particular is that given the way the swabbing is done, a lot depends on the way in which the swab is taken. If a swab is taken incorrectly, it can generate false positives as well as usually false negatives in this situation. But what we know with any test is that there is the possibility of any false positive or false negative result. But that's not the place where the analysis ends. We also have to keep in mind what the background rate of disease is in the population. And that leads to another set of epidemiological parameters. We won't go into that. But the bottom line of all of that is that when you account for the rate of disease that exists in most states, including Maine, the test that we use most typically these days, this PCR test, is incredibly accurate at sorting out which folks have the disease and which folks don't. I'm going to turn next to Maria Sacchetti at the Washington Post.
Hey, thanks so much for having this. Pardon me. I just had a few quick questions. Of the deaths that you've had so far in Maine, do you know what share have been in nursing homes or long-term care facilities?
Maria, we'll get you the exact number. It's been a few days since I've taken a look at that. We'll get you the exact number very soon.
Okay, if it's the majority, that's also good to know. And then I wanted to also ask, has anyone lost their license or been punished for violating the quarantine rules up until now?
Lost their license?
License to do business. I think Heather Johnson discussed that perhaps. And the answer is yes, somehow.
Yes. Do you have any examples, Governor? Or how many?
We can get you that. I mean,
Okay.
There's been some very public cases where people have lost their food license and had their liquor license taken away, at least temporarily.
I see. Okay. And then, and also, Governor, I wanted to ask you, please, these new exemptions that you're announcing, why do them now and not a week ago? We're seeing a lot of empty inns or half-empty inns and hotels up here in the Bar Harbor area and elsewhere on the coast. What was the tipping point for you? Why did you decide to do this now?
Look, this is a public health issue. It's not about whether the streets are full of people or not full of people, although that's been a concern, the public gatherings that are associated with many of our coastal towns during the tourist season. But I know you and I are going to have a longer conversation about this a little later on. But no, we looked at the metrics going back in 10 days or so. Last week, things were not at the level they're at now in New York, Connecticut, New Jersey. We looked at their recent history and where their positivity rates are and what the trajectory seems to be there and the number of overall cases per capita. And we were satisfied that their rates are coming down sufficiently to put us on a par, put them on a par with the state of Maine, as Dr. Shah already suggested.
Okay, thank you. And sorry, one last question. Perhaps this is for Commissioner Lambrew. How much do the lab tests cost? If you're not covered?
Yeah, that's a great question. We've seen stories across the country about the variable price of lab tests. So going back to what we do know here in the state of Maine is that our public health lab, the Health and Environmental Testing Lab, has been using grant funding to provide tests without billing for it. Sometimes there's a collection cost to get that sample, to send it, to ship it. Again, a lot of our organizations in Maine have just been doing that to date because it's the right thing to do. We are, as we are expanding our capacity, going to pay those sites for that collection cost and sending them to our lab. We propose $30 per sample sent to us, and that's about a little bit above what Medicare pays. But we know the underlying cost of a test plus that sample collection can range anywhere from like the $75 range. We've seen it up to as much as $200 and north of that. There is no national price ceiling on COVID-19 test costs at this point. And we appreciate the fact that people should really make sure and call their insurance company, call the site that they're going to get tested before they go to make sure that they know what, if anything, they have to pay. But as a reminder, in the state of Maine, we have said that insurance companies should cover the cost of testing for symptomatic people or people at elevated risk.
And I think,
thank you very much.
Commissioner Lambrew, you're assuming tests the samples are taken in Maine and the test is conducted in the state of Maine for the most part, and where the cost would be lower because there are no transportation or courier costs. And I think on my call with the White House this week and last week, it was emphasized as well that the federal government is standing up some of the costs of the commercial labs, the pharmacy-based tests, and that is going to continue through August. That's my understanding.
We're going to turn now to Joe Lawler from the Press Herald.
Yes, hi. A couple of questions. My first question is, it's interesting you were talking about New York, New Jersey, and Connecticut. Both New York City and New Jersey recently decided to put a delay on allowing indoor dining at restaurants. And I'm wondering if that is, and not based upon what was happening there, but based upon what was happening in other states and outbreaks in other states. And I'm wondering if that is on the table in Maine, under consideration in Maine. And my second question is, I noticed casinos still haven't been part of the stage 3 opening checklist. And are casinos being delayed for opening? And do you consider them especially risky to reopen, kind of like bars? Do you consider them casinos in that same category?
Well, it speaks for itself, the fact that they were not in stage 1 or 2, that they're still talking with us. We are trying to determine a way where they can open safely and still meet the gathering limits and meet all public safety criteria, public health criteria. That's still in negotiation, still underway, still in discussion. In terms of the restaurants in New York, I only know that I read in the paper a week or so ago that when they did open up, there was an influx of people, and it seemed unmanageable at the time, and that's why the governor or the mayor or both decided to draw back on those that opening. But that does not in itself seem to have affected their positivity rate or the other metrics, public health metrics that we're looking at.
Thanks, Joe. We're going to turn to Amy Brown at WERU.
Thank you, Dr. Shah. Governor Mills, store and restaurant employees in other states have been assaulted when trying to enforce face covering, wearing face coverings. And here in Maine, people have reported there have been several incidents of people being harassed and verbally abused. a lot of these places don't have any kind of security staff. Probably most don't. We're also hearing from workers who are being told that they are not allowed to ask because of the medical exemption, that's an ADA thing. And in parking lots, people have to have a little tag to display in their car to park in designated spots because of medical reasons. Is there any way something like that could be put in place in the state, given that this is a potentially life-threatening situation, so that people stop exploiting that loophole in the order?
You mean to give them a mask-free passport or something, an insignia?
Something from their doctor that doesn't say necessarily what their condition is, but just that they have a medical exemption so that they can prove that, because that's what people are using. And that's why a lot of store managers are instructing their employees to not ask, because they're afraid of ADA violations.
And now we're telling them to ask. And my own personal opinion is that it is not an ADA violation to ask. And it doesn't do any harm for someone to get a letter from their doctor. The same thing goes for seat belts. There are very few exemptions to the seat belt requirement. That could be a medical issue with respect to your intestines, your midriffs and whatnot. And some people can get doctor's letters saying that they have an exemption, they should be exempt from seatbelt requirements, although it's pretty rare. But we are asking the store staff and the managers to actually ask the question and to make sure that people are wearing masks. It's not just about the health of the person who doesn't want to wear a mask or can't wear a mask for some reason, about the health of everyone else in the store and the public in general.
Sure. And I'll just add, if you don't mind, that, we did think about this question. We certainly have heard the concern about the kind of the enforcement angle from some of these stores, but a few things. Number one, we are limiting the policy to those areas where visitors go. Why? Because visitors from out of state may not know Maine policy. Second, we are trying to limit the types of places. So we're sticking to large retail establishments, hotels, lodging, restaurants, and outdoor bars and tasting room where people go in and out of a building. So we really are focusing down this policy on places where visitors come. And the reason we're doing this is partly to protect them, but also to protect those workers. We think that the workers in Maine in hospitality and tourism are at risk. We want to protect them. And one of the best ways we can protect our own workers here in Maine is through ensuring that people who come into their facilities have those cloth face coverings.
It does seem that they're put in a predicament where they can either potentially go up to someone who is going to be combative with them with no backup, or they can just let it go and be exposed to COVID. That's kind of a bad spot for people with no security backup to be put in. Is law enforcement stepping up in these crowded situations like Wharf Street last weekend in the Old Port and issuing any kind of citations to individuals?
Amy, it's the same thing as saying no shoes, no service, no shirt, no service. If you walk into any store in Maine that says you got to wear shoes and shirts or something, and you're told to leave, you're most likely going to leave. I hope you don't get combative. It's just the rules. It's the rules of the game. And, this isn't a matter of making political statements anymore. Vice President Pence was on the phone with me the other day, and everyone was urging him to be more forceful, and for the president himself as well, to be more forceful about wearing masks and telling everybody to wear masks. And he agreed. Republicans and Democrats agreed on the call with 50 governors. And we will also have, in many of these same towns and areas, public health officials, code enforcement people, or eyes and ears on the ground to help educate people about why it's important, why it's necessary to protect the public health, that everybody wear masks whenever possible, when you expect to be in a crowd or be among people where you can't keep distance.
Thank you. Dr. Shah, a listener wanted us to ask you about the response rate for contact tracers in Maine after hearing that in Massachusetts only about 60% of the contacts are responding to the contact tracers. Are you having a better success rate here in Maine?
We are, Amy. The last time I received an update on this was a couple of days ago, when the response rate for our contact tracers was at least around 90%. We run those data on an occasional basis. I think Wednesday is actually the day in which we run those data. So we'll get you the latest response rate, but it was quite high here in Maine. It speaks to the willingness and the cooperativity that we've seen across the state from folks as we've tried to navigate the pandemic.
Great, thank you.
I'm going to turn next to Patrick Whittle at the Associated Press.
Thank you very much. Two semi-related things. Is there a way to quantify the amount of PPE that there is in this state, and whether or not the state has enough to handle a new surge of the virus? And also if there are plans to acquire more. And additionally, today is July 1st, which I believe marks the beginning of a new phase of reopening in some sectors. Could we just sort of get some highlights about what is open today that perhaps wasn't as recently as yesterday?
Yeah, I was going to do that anyway, and thank you for reminding me. Today, July 1st, the beginning of phase 3, stage 3, spas and skincare establishments across the state are open. Outdoor amusements, such as amusement parks and water parks, are open with obviously public health criteria and checklists. Indoor amusements, such as bowling alleys and arcades, may open, again with precautions. Movie theaters, again with all of these with capacity limits, gathering limits. But movie theaters, I'm particularly excited about that. Kind of missing going to movies. But again, with no more than 50 people at a time in a theater. Those are the basic highlights. Performing arts venues may open. Again, the gathering limits is going to limit what they can do and the capacity of their audience, but they're open.
Patrick, on the PPE question, I haven't read out the inventory of PPE in a while, so what I think I'll do is we'll email it to you, Patrick, but I've got it right here. We've got about 370,000 N95s and 3 million surgical masks, et cetera. But I think the essence of your question is whether that's sufficient for what we anticipate could be a sustained, sort of long-term sustainment of our activities. So right now we're actually undertaking a planning process to try to come up with different projections about what we may need to keep the PPE backlog, the PPE stockpile healthy in the event that we have a significant spike. We're actually working on that planning process right now, but we'll email you the daily inventory of what we've got on hand.
And I will add, we get a weekly report from the federal government about the PPE delivered directly to some 100 plus nursing homes across the state of Maine. We get that by nursing home and by county.
I appreciate the email. Could you just repeat what that first number was? It was 3 million surgical masks, and before that it was
373,370 N95 masks. That's 373,370. And then on the surgical masks, it is 3,085,900 surgical masks. I've got a long list of numbers that I'm not going to read, but we've got them right in front of me, in fact.
Great.
So we'll get those over to you ASAP.
Thank you very much.
You bet. And the last question for the afternoon goes to Emily Tadlock at WABI.
Thank you. I actually have two questions. The first one, I'm kind of going to circle back here because I think some businesses would argue that no shoes, no shirt, no service is not the same as no mask, no service because of certain health conditions that people may have. And I think people really are worried about potential lawsuits from customers wanting to come in, stating that they have a medical condition and then not wanting to disclose that information to someone. So maybe, Governor, if you want to just circle back to that, I think a lot of businesses are worried that it's not the same.
Well, honestly, I think you have a right to ask, what is the medical condition that prevents you from wearing a mask? You do have a right to ask that question. If somebody's insisting that they have a medical condition, you have a right to know what it is. And it's not a bad idea, as one previous questioner suggested, to have something to know from your doctor. If you're being treated for COPD or emphysema or pretty serious lung disease that prevents you from breathing, if you have a thin cotton fabric mask or other mask, then you should find out from your doctor, well, is there a reason I can't wear a mask? Should I be able to wear a mask anyway, despite my lung issues or whatever. I would want to do that myself if I had some condition that I thought would prevent me from wearing a mask. I'd want to get a doctor's note. There's no harm in asking.
I think the question really is it lawful for these establishments to ask, just so that they don't face a lawsuit coming back from a patron?
We believe it is lawful to ask, yes.
And Maine is not the first state that has this sort of policy. This is now becoming very common in different states. So we're looking at other states as well, and also trying to make sure that our establishments have that kind of training to have the support so that they can de-escalate circumstances where there's some hostility. We also think that this is about public health. We've launched our Keep It Healthy campaign to try to encourage people to follow the practices that are recommended by our public health communities. The city of Bangor has its own face covering campaign that we think is quite clever, and we're looking at advancing that because we want to separate out. There will be a subset of people and a small fraction of people for whom the medical concerns are real. But that's what we're getting at. We're getting at the fact that there are anecdotes out there that as time goes on, as the risk feels like it's not great, or people coming from other states who don't know Maine policy, who think they're on vacation and can just take off a face covering. We want to get at the majority of people to make sure that when they're coming into our state, they're coming into our restaurants, our hotels, they're keeping those workers and the other guests safe.
I'll just conclude by noting, Emily, from a medical perspective, the list of verified diagnosed medical conditions that would positively, categorically preclude somebody from wearing a mask, a face covering, for a short period of time is quite small. And those individuals, as Governor Mills noted, should be in contact with their doctor to talk about whether that face covering is appropriate or indeed probably whether they should be out shopping in the first instance. But the overall list of conditions for whom, a number of people for whom that absolutely categorically applies is overall quite small.
Okay, great. And I had one last question for you, Dr. Shah.
Sure.
You mentioned, I believe you mentioned earlier that the cumulative positivity rate has just slowly kind of crept back up just a hair. What is the number, the turning point maybe that we'd have to see for things to shut down again like we've seen at other states?
Sure. So first, Emily, the cumulative positivity rate has actually continued to creep downward. That's now at 3.85%. You may recall just a couple of days ago, it was at 4%. That number has continued to go downward. The number that has taken an ever so slight uptick is the 7-day weighted average positivity rate, which is now just under 2%. Well, with respect to your second question, though, we don't look at any single number when we're thinking about decisions of policy. Our policy decisions are based on a holistic review of a number of criteria and empirical factors. Positivity rate is one of them, but we're also simultaneously looking at the number of hospitalizations, the number of folks in the ICU, the number of new cases, things of that nature as well. So there's not a single on-off switch that is driven or determined by the positivity rate.
And if I might add, the same logic holds true for our decisions about who is exempt from our quarantine or travel rule or quarantine or testing rules. There's no single measure. So while some states, like somebody raised Massachusetts and Rhode Island earlier, may look good on some measures, we're looking at a totality of measures. And that's why it may be that, again, you pick one or two, it may look like it's good, but our whole goal is to ensure that the states where we're allowing visitors to come without the quarantine or test policy are roughly similar to Maine's on multiple dimensions. I don't know if you want to speak to that, Dr. Shah, because that question comes up a lot.
It does. And it really, I think in my mind, as I think about that, it's kind of the proverbial different individuals having their hand on a different part of the elephant, and each of them describing it in a different way. Outbreaks, especially across different states, are very similar to that. And if you only look at what you're seeing and the number that you think is the most important, you're not getting that holistic view. When we think about policy, we try to look at the entire elephant to make sure we're getting the full picture of what's going on. We've had a lot of folks reach out to us and say, well, if you look at this one website and you use this one single number, then this is what it looks like, and that's what you should base all of your policies on. But it's simply not that easy. We've got to take a broad look to make sure we're getting the full picture of what's going on in any state as well as within our state.
Thank you.
Governor, you bet, Emily. Governor, Emily's question was the last one. So Governor Mills, I'll turn it back over to you.
Thank you. You know, I think we're trying to balance so many things here every day, every week, whether we're on camera or not. And I find it interesting to talk to the other governors of other states. And when I heard from Governor Abbott the other day that their positivity rate went from 4% to 14% in just a matter of days, something he attributes to Memorial Day gatherings. And within the 2 weeks after Memorial Day, they saw their positivity rate shoot up. It wasn't just because of the number of tests they're doing. And those are the kinds of things we're very wary about. So while we welcome July 1st, we welcome the heat and the influx of tourists and the good weather in Maine and the great opportunities to be outdoors. We also want to remind people that, again, in many of these other states, half the people testing positive are under the age of 30. So it's a virus that will strike you no matter how old you are and either make you sick, possibly take your life and your breath away, at the very least, allow you to transmit that virus to other people whom you won't even know are extraordinarily vulnerable to the virus. So remember in Maine that about 60% of our entire population have some vulnerability. 22% of us are over the age of 65. These are things that are unique to our state that we're very cautious about when we talk about millions of people coming here during the tourist season and welcoming their presence, their influx in the economy, and money spent at restaurants and hotels and stores and campgrounds. At the same time, we're very cognizant that Maine has a unique demographic with many people over the age of 65, many people with high blood pressure, some level of obesity, diabetes, one of the highest childhood asthma rates in the nation, COPD, and immunocompromised individuals. We're trying to protect everybody. And when we ask people from Massachusetts, stop and get a test. You know you're coming here beforehand. At least if you can't stop in Massachusetts, stop in New Hampshire. They've got an abundance of testing sites in New Hampshire on your way here. It's for your sake and for all of our sakes as well. What was moving to me in the last week or so was receiving several messages, one of which I talked about last week and another of which we got over the weekend, from individuals coming to visit family and friends in Maine who balked at the testing requirement, didn't want to do it, but coming from places like Arizona, for instance, stopped to get the test and found out, unbeknownst to them, they were COVID-19 positive. And one of them wrote, quote, "This is truly a nightmare. If I can get it, anyone can. Stay home. You don't want to feel what I'm feeling, that I have put the lives of my loved ones at risk." That's what she wrote last weekend. So while we want to see the economy revitalized, we want to welcome people here to Maine, we want to advertise Maine and brag on us that we are the safest state in the nation, the safest in terms of health and health care and low crime rates. And we want to stay that way. And with the help of everyone listening and watching, we will do that. Thank you very much.
Great. Thank you, Governor. Before we wrap up, one programming note. In observance of the 4th of July weekend, there will be no scheduled media briefing this upcoming Friday, July 3rd. If, however, there are important matters of public health significance, we will convene one. But as of right now, there's no scheduled media briefing for this Friday, July 3rd. So with that, thank you very much, Governor and Commissioners. Josh, as always, thank you for your help. We hope everyone has a safe and restful holiday weekend. Thank you all very much. We'll catch up again on Monday. Thank you.
Happy 4th of July.